We're going to look at the next subtopic, cardiovascular system examination in children or in pediatrics. Like I always tell you, in pediatrics or generally in medicine, if you want to examine any patient, the first thing is to always what? To take consent, okay? Then you stand on the right side of the patient. Always stand on the right side of the patient and screen your patient. Your patient deserves some privacy. So screen your patient, take consent, and stand on the right side of the patient. So this is the algorithm for what? Cardiovascular examination. I stands for inspection, P, palpation, P, percussion, A, auscultation. That is IPPA. Inspection, palpation, percussion, and auscultation. So that is the format, that's the standard format. So in case you're asking an exam, what is the standard format for examination in children? Just write what? Inspection, palpation, percussion, and what? Auscultation. When we say inspection, see, to see. Palpation means to feel. Percussion, you are touching the patient. Auscultation, listen by using your what? Your stethoscope. So under inspection, by quickly doing what we call a quick general examination, you want to look at the patient. Is the patient dyspneic? When we say a patient is dyspneic, it means that is the patient having any respiratory distress? Is the patient in any respiratory distress? Okay. Is the patient cachectic? Is the patient looking well or not? That is on general examination under inspection. After that, then you look at the eyeball of the patient. Once you look at the eyeball of the patient, you can judge whether this patient is pale or this patient is jaundiced. Jaundiced. Okay, when we say jaundice, jaundice is yellowness of the skin and the conjunctiva, jaundice, or we call it icteric. Is this patient icteric or not? That is under inspection. Then you can also look for other things like what? Clubbing, finger clubbing. Look for finger clubbing. Okay, so that is under quick general examination. Then you feel for the lymph nodes. All this I'm going to teach you in class. But please just know, for the purpose of this examination, the first standard criteria that we look at during examination is what? IPPA. Now, another important thing that we do in children, or that we check, is what we call the vital signs. The vital signs. We check the vital signs. So the vital signs that we usually check start with pulse rate, respiratory rate, blood pressure and SpO2, and also temperature. So by checking the vitals, we start with the pulse rate. The pulse rate in neonates. Neonates are children within the first 28 days of life. It is usually between 120 to 160 beats per minute. Beats per minute. That's in neonates. In infants, those are children in their first year of life. Infants, between 110 to 150 beats per minute. In older children, 80 to 120 beats per minute is fine. Okay, then by the time you get to adults, of course, 60 to 100 in adults. But here we're talking about pediatrics. So that is for the pulse rate. For the respiratory rates, usually for neonates, we use 30 to 50 cycles per minute. Then I told you in class, how do we check the pulse rate? Use the top of your two fingers here on the radial artery. Then you count for what? 60 seconds. That is the pulse rate. For the respiratory rate, just look at the patient clearly. Then look at how the chest is moving up and down during inspiration and expiration. So by the time you count for 60 seconds, in neonates it should be between 30 to 50. While in infants, we usually use 30 to 40, some say to 45, no problem. So 30 to 45. While in children, we usually use 20 to 30. And of course, in adults, 16 to 20 or 16 to 22 is fine for adults. For blood pressure, in children, we have special cuffs that we use for them. And anytime you're checking the blood pressure in children, you must always check both arms and the both leg. They should normally be the same. But in a very rare case, we have what we call coarctation of the aorta in some diseases such as coarctation of the aorta. You can read this on your own. In coarctation of the aorta, the arm blood pressure is greater than the what? Leg blood pressure. So, as an health practitioner, you should always know that in children, we check for all the limbs in checking their blood pressure. XPO2, that's the saturated partial pressure of oxygen. In children, we usually target what? 94%. 94 to 100 normal. Okay? That's using your what? Your pulse oximeter. Temperature, using the what? The axilla. Like I told you in class, the best place to check for temperature is what? The rectum. Okay? So rectal temperature is the most accurate, but majorly or usually we can always check what? The axillary temperature. So normal temperature should be less than 37.2. If it is higher than that, we say the patient is having what we call hyperthermia. So normal temperature should be between 36.8 to 37.2. Anything greater than 37.2, we say the child has what we call hyperthermia. And less than 36.8, we say the patient has what we call hypothermia. Okay, if the BP is higher than normal, that's hypertension. The BP is lower than normal, that's hypotension. If the respiratory rate is higher than normal, we say the patient has what? If respiratory rate is higher than normal, we say the patient has also called tachypnea, or patient is tachypnic, tachypnea. If it is less than normal, we say the patient has also called bradypnea, bradypnea. For pulse rate, if it is higher than normal, we say patient has what we call tachycardia, tachycardia. And if it's lesser than normal, we say the patient has what we call what? Bradycardia, bradycardia. So that is under what? The general examination and the vitals check. Now let's go to the what? To the examination of the heart itself. Now the heart is located at the what? At the left side of the chest. Left side of the chest. But we now have what we call the apex beat. In children, their apex beat, in children, I'm not a child, in children their apex beat is located at the fourth left intercostal space. Fourth left intercostal space, midclavicular line. Fourth left intercostal space, midclavicular line. So what that means is that by the time you check their chest, this is what we call the clavicle. The next rib you can feel there is called what? The second rib, followed by the third rib, followed by the fourth rib. So in between the third rib and the fourth rib in children, that is where you can what? Feel the apex beat. Fourth left. Now this is the clavicle. This is the medial border. This is the lateral border. So the middle, so you trace it down. So the fourth intercostal space. The fourth intercostal space is between the fourth rib and the fifth rib. Sorry, this is the fourth rib and the fifth rib. That's the fourth intercostal space, left, not the right. If the child is having the heart on the right, we call it dextrocardia, left on the right. That is abnormal. Okay, normally most of us have our what? Our heart located on the left side of the chest. So fourth left intercostal space, midclavicular line. In children less than 7 years. Once the child is more than 7 years, we expect the apex beat to be in the fifth left intercostal space, midclavicular line. This is going to come out what? In your exam. Midclavicular line. Okay? Don't forget, in children less than 7 years, apex beat is located at the fourth left intercostal space, midclavicular line, and in greater than 7 years, fifth left intercostal space, midclavicular line. And anytime you want to examine the chest, you must always position that patient angle 30 or angle 45. I'll show you that in class, don't worry. So the normal position